Hi, good evening. Hello, Chitra, am I
Yes,
audible?
sir. Yes, sir. Good evening, sir.
Good evening.
Good evening, sir.
Good evening, Kangan.
Good evening, sir.
Hi, good evening, Pallavi. So, guys, you are live on YouTube right now. Okay. So we'll wait for 2 4 minutes, or we'll start. Ritvik, can you please share the YouTube link in all the groups?
Yes, sir.
So, guys, you can start. Actually, people are joining here and on YouTube live.
Okay, sir. Hello, good evening, everyone. Hope you all are feeling great this evening. We all love our teeth, and why wouldn't we? Our teeth help us accomplish so many things. Without our teeth, we couldn't eat, smile, or talk. It only takes a few up and down movements with your brush every day to keep your teeth happy. Have a great oral health day. So, in honor of our pearly whites, we welcome you to the most intriguing webinar on World Oral Health Day. I'm Chaitra, a family intern and a research intern at CliMed Research Solutions, and I will be your host for today. This webinar is a small initiative by CliMed Public Health Awareness Series under CliMed Research Solutions. CliMed Public Health Awareness Series is an initiative under CliMed Research Solutions that presents you 365 days of learning. The concept is to create an educational hub where we spread awareness in different forms like webinars, podcasts, and competitions, which act as the one stop solution to clear all the myths and queries regarding various healthcare related issues. A platform open to all for curated, limited, informative public health awareness series learning throughout the year. Now, while talking about the webinar, it includes a panel discussion between all our eminent panelists, and you can clear all your myths and doubts with regard to oral health. You'll also get to know the winners of the CLE Art competition along with the panel experts. I think some of you are thinking, what is about CLE Art? The CLE Art competition is conducted for all the persons, irrespective of age, for the occasion of World Oral Health Day with the theme Oral Health and Hygiene. We have divided the people into eligibility criteria for three categories. Category 1 is for kindergarten to grade 5. Category 2 is for grade 6 to 10. This category 1 and 2 are for kids, and the goal is to spread awareness on the importance of oral health and hygiene amongst the kids and give them a platform to showcase their ideas. And the category 3 and final category is for anyone who are interested in any discipline, and this has no age barrier. Let's not waste any time and slide right into our session. But before that, I would like to add a few key points. Please keep yourselves on mute throughout the session, and if you have any doubts, please type in the comments in the chat box and we'll clear it out at the end of the session. With great honor, I would like to introduce our speakers for today, Dr. Chandrasekhar Alladi, sir, and Dr. Reika Allari. Dr. Chandrasekhar Alladi is one of the best dentists in Hyderabad. He has completed his bachelor's degree from the College of Dental Sciences, Davangere, and completed his master's degree in the field of oral and maxillofacial surgery and dental implants from Raga's Dental College, Chennai. After completion of the post-graduation, Dr. Chandrasekhar went on to acquire higher skills in the related field. He has won Dr. APJ Abdul Kalam Excellence Award for Dentistry and has achieved numerous awards for his long successful career as an oral and maxillofacial dental surgeon. He has conducted many seminars and workshops to bring new technology in the field of dentistry. For more than 15 years, he has been serving people in the field of dentistry, and he has conducted countless successful complex surgeries, and 30,000 happy patients have made him the most famous dentist in Hyderabad. And now, with great pleasure, I would like to invite Dr. Reika Allari, popularly known as the dentist of the people and considered as one of the best dentists in Hyderabad. She has completed her bachelor's degree from Mamata College of Dental Sciences, Khammam. She is specialized in the field of cosmetic dentistry and smile designing, and she has received a gold medal at her graduation level. She has rich experience in the field of cosmetic dentistry and understanding the root cause of dental problem. She always spends her time with the team to raise the awareness about the origin of dental problems and solutions for it. Both of them together are running Happy Smiles Dental Care, a multi specialty dental hospital, and its main aim is to provide convenient, compassionate care with personal touch. It's established in 2008 and has treated more than 30,000 patients. Presently, the clinic has empanelments with Telangana Police, Andhra Pradesh Police, EHS of Andhra Pradesh, and Telangana government. We welcome you, sir. We welcome you, madam. Now, I would like to invite Dr. Ajit Singh, co-founder and CEO at CliMed Research Solutions, National Director of Research at World Youth Heart Federation, to welcome both sir and ma'am. Over to you, sir.
Hi, good evening, everyone. So, yes, first of all, I'm sorry. Actually, I'm not available for last 1 or 2 days with our, interns and with our team. I'm outside traveling, but yes, I would like to thank Dr. Chandrasekhar Alladi and Dr. Rekha Alladi, who is joining us today for this occasion and to, spread the awareness among our students and among kids and kids' parents who are, like waiting for this event on our YouTube channel and here about the oral health and dental hygiene and oral hygiene. See, this is very really important for everyone. Not only the kids whose teeth should taken care by a dentist or by the parents or by themselves, but it is very important for the adults also. As we know, as I've done my a PhD and I'm from the cardiology background, so I know how dental care and how oral hygiene affect the cardiac problems. Many cardiac problems like myocarditis and other infectious disease. These are originated from the from your mouth only, from your teeth, or if it is not well taken care. So that's why we thought to conduct this webinar on this occasion, and we opened the competition for the kids also for age of for the any age. People can join and people can show their art, and people can learn from our experts. So without wasting much time, actually I'll be joining just for 5 to 10 minutes. So guys, uh, thank you very much, Dr. Chandrasekhar, that you have accepted our invitation, and Dr. Rekha, thank you very much for joining us and to share your precious time and share your views today. And we are glad to have you on board. And I would like to welcome Pallavi also. Dr. Pallavi is BDS final year from Manipal, and she will be our host for today. So Dr. Chitra will be introducing her again. But thank you, Pallavi, for joining us as a host. And when Pallavi is there, I have no worries. She can take care of all the queries, and she can take care of the hosting very well. So I hope this journey will be really good for next 1 hour, guys. Enjoy this and learn well, and clear your doubts with Dr. Alladi and Dr. Rekha Alladi and Dr. Chandrasekhar Alladi. So thank you very much, all three of you again. And guys, take care and learn well. Thank you very much. Thank you,
Thank you.
Chaitra.
Thank you, Dr.
Thank you.
Ajit.
Thank you, sir. Thank you very much.
Yeah.
Thank you.
Thank you, sir. Now the session is going to be very interesting with an interactive panel discussion, which is going to be hosted by Dr. Pallavi, BTS intern at MCORDS Manipal. We are so happy to have you with us, Dr. Pallavi. Over to you.
So, good evening, everyone. I, Dr. Pallavi from MCOS Nepal, would like to thank Dr. Ajit Singh and entire CliMed team for giving me this wonderful opportunity for being the host this evening. I'd also like to welcome our chief guests, Dr. Chandrasekhar Alladi and Dr. Rekha, for this question and answer session of ours. So it's well said that mouth is the mirror of the body, and this mirror needs to be kept clean. So today I would like to present a few most frequently asked questions, which some or the other way each and every dentist would have had heard in his entire career. So, sir and ma'am, the first question here is, what should be the basic age or the age at first when a kid should actually go to a dentist and visit for the first time?
Hello, everyone. This is Dr. Alladi Chandrasekhar. I thank CliMed and CliWare for giving me a wonderful opportunity to attend this webinar and clarifying you doubts on this oral health and oral hygiene. Okay, and I also thank Rutvik to invite me to attend this webinar. Thank you so much. And going to this question, Dr. Pallavi, we always suggest parents to bring their kids at age of 1 to get the oral health checkup done. Having said that, oral health is actually a gateway for the systemic health. Okay,
Yes.
so whatever diseases are there in the body, we always have a signal of some symptoms in the oral cavity. Okay, so always we advise parents to bring their children at the age of 1, and from there onwards every year once we advise for checkup, so that any dental abnormalities or dental irregularities are there, we can correct from time to time.
Yes, sir. So, this same question would lead us to the second, and that is, like this question has been asked by most of the new mothers out there, that how to keep a nursing baby's mouth clean.
See, we always suggest our patients like to keep their baby's teeth clean and healthy when they emerge from the oral cavity. We usually advise them to clean with the clean fingers. Okay, and we certainly we don't advise the patients to use the toothpaste and toothbrush till the age of 3 years. Like, okay, so always we have to make sure that clean fingers are always better to keep the child's teeth healthy, and always we have to make sure that their tongue and roof of the mouth is cleaned from time to time to prevent any oral diseases.
Yes, sir. So, the third question, so Rekha ma'am, this question, it goes something like, is it okay to leave a sweetened pacifier or a bottled nipple in a newborn's mouth? Like, is it fine to keep it overnight, or maybe let it till the time the kid feels that now he or she is not hungry anymore?
Yeah. Hi everyone. Hi Pallavi. And thank you for the team of CliMed for such a warm welcome. And special thanks to Pallavi and Rutvik. So I'm Dr. Rekha. So coming to your question, Pallavi, I would like to answer it in this way. We usually do not encourage any kind of pacifiers or sweeteners in our kids' mouth, because this results in caries, and especially kind of rampant caries. So it is not at all advisable for a kid to have any kind of pacifiers in mouth.
Yeah.
So I advise the parents to have a knowledge about this.
Yes. So the next question goes like, what kind of brushing techniques would you like to suggest to our viewers? Because people usually tend to brush for a longer while with heavy forces, or they think that if we'll brush for like 5 minutes or 7 minutes, our teeth are going to shine like anything. So what would you like to suggest all those viewers out there?
So ideally speaking, just a 2-minute brushing protocol is recommended. That is scientifically called as something called as Bath technique of toothbrushing, wherein the the toothbrush is placed at an angle of 45 degrees to your tooth surface, so that the gum area as well as the tooth area is effectively cleaned. So I would like to request Dr. Chandra to show up a model so that our viewers would be able to understand in a better way.
Thank you, Dr. Rekha. Okay. Hope everyone can see this.
Pallavi, is
Okay.
it clear? The video,
Yes,
is it
ma'am.
clear? Yeah.
Yes, ma'am, it is.
Can you see the model, Pallavi?
Yes, yes, sir. I can see the model.
So we usually advise patients to do this modified Bass technique of toothbrushing. So where a brush is angled at 45 degrees between gum and teeth, and brush gently in a to and fro motion, and from there we have to swipe the brush along the surface of the tooth. So the main purpose of this toothbrushing is to avoid untoward forces on the tooth and to prevent the abrasion of the teeth. Okay. And the main purpose also of this brushing technique is usually when we brush the teeth, only the frontal surface and palatal surface, like front surface and back surface and up surface of the tooth are clean, and usually there will be a lot of food lodgement between the
Hmm.
teeth. So with this
Hmm.
technique of toothbrushing, the food which is accumulated between the teeth is also cleaned, and your gums and teeth will be in a healthy condition. So
Yes.
I want to show again to our the participants who are in this meeting. So the correct way of brushing. So you have to hold the brush. You also have to hold the brush very gently. So if you hold it tight, you tend to brush hard. So hold very gently in your hands and angle the bristles at 45 degrees to the in between the gums and teeth, and brush in to and from motion. From there you have to swipe it down. So you have to carry out the same motion all over the oral cavity.
More or less, this is a vertically oriented kind of toothbrushing. But normally, what we generally see with the patients is they go in for the horizontal kind of brushing.
Hmm.
So that is the reason I wanted Dr. Chandra to show you all that this is more or less a vertical oriented brushing,
Hmm.
where this does not result in cervical loss of enamel.
Yes. So,
For better understanding to the general public, usually there will be a wearing of enamel if you brush hard. So try to keep your brush gentle. Use medium to soft toothbrushes, and do not apply aggressive pressure on your toothbrush to brush your teeth. And completely you brush for 2 minutes in a right direction for better oral hygiene and for better condition of the teeth.
yes, sir. So, for the kids out there, there is this little rhyme called as up and down, round and round. So that is
Yeah,
how you can keep your mouth clean.
yeah.
So, sir, the next question is there anything in specific which the kids are not allowed to eat so that to keep themselves away from dental caries?
Yes, of course, we suggest kids not to eat chocolates like the food which has a lot of carbohydrates. Yeah, as you know,
Yeah.
like carbohydrates accumulate on the teeth, and the plaque will get dissolved to, and we'll have a lot of cavities. So we usually advise, as a dentist and as a father, I advise patient to eat a lot of chocolates, but and at the same time, I advise them to brush twice daily and have a proper oral hygiene. And we cannot stop kids from eating chocolates, that we all know.
Yeah, true
One
that
more
is.
thing I want to mention here, Pallavi. Sorry for the interruption.
Yes,
I would
ma'am.
One personal suggestion I would like to give to the kids all out there is do rinse regularly. Whether
Hmm.
you have
Yeah.
liquids, solids, whatever it is, do rinse regularly. So that would help in maintaining your oral hygiene.
Yeah. And I would like to add a tiny little point, which I usually do. Even if you eat sweets, kindly eat it with your meals so that they won't get stuck again at some other region which might not be accessible. So,
Yeah.
one other thing which usually even I feel troubled up is flossing. Like flossing up the teeth is like one big deal, and I know most of us do face the problem. So, like, what do you say about it? Like, how important flossing is, and how are we supposed to floss our teeth?
See, flossing is something which is really important, and everyone has to have that understanding that brushing the teeth is only the 25% of your oral hygiene maintenance. So you brush your teeth, front, back, and top. Only your teeth surface is clean, but your 50 to 60% of food is accumulated in between the teeth. So I advise strongly my patients to use interdental brushes or flossing regularly so that you don't have cavities in between your teeth. And also we advise patients to use tongue cleaners and clean the roof of the mouth so that there won't be any oral hygiene maintenance issues in the oral cavity.
So, so, ma'am, there are like this two schools of thought. One saying that we are supposed to brush twice daily, once after getting up and one before going off to sleep. And then there is this other school of thought which says that we are supposed to brush after every meal. So, what would you like to encourage?
Personally, I believe twice brushing daily should be sufficient, not after every meal. Probably rinsing after every meal and whatever you eat or drink, that should be sufficient. And after every twice brushing daily should be more than enough.
So, sir, there is this one big problem which parents think. There is this age group of kids from like around 8 years to 9.5, 10 years, the ugly duckling stage, when kids tend to have bigger front teeth and some sort of spacing between the anterior teeth called as diastema. So, is it actually a big trouble as people, like as parents, do think, or what are your views on it?
We tend to see a lot of patients. Like with every day, we come across patients with a lot of confusions and myths about the dentistry. So this is one of the myth which we face from the patient. Having the spacing at the early age is something which is abnormal, and a child will tend to have that spacing which is continued in the rest of the life. So again, this oral awareness is something which is very important across the people, which we have to, as a dentist, we have to create oral awareness to the people. This is also a part of oral awareness where and also apart from the spacing, we usually come across patients like age where the tooth will be badly decayed, but still kid will have pain and parents will be reluctant to get the treatment done. They say that this is a milk tooth and which is going to shed, and we don't want have any treatment for the child at this point of age, because anyway the teeth are going to shed and permanent tooth are going to erupt. So there are a lot of myths and confusions which will be running across the people, and this is how this oral health day and oral hygiene day, this awareness has to be created well in the society, and overcome all these particular things.
So one more question, like people tend to eat toothpaste, the kids specifically. So is it fine that a kid and an adult to be using the same sort of toothpaste, like the one with the same amount of fluoride in it? Ma'am, would you like to?
Yeah, see, yeah, last. Yes, Rekha, Dr. Rekha.
Yeah, Pallavi. So ideally speaking, children need a more amount of fluoride in the toothpaste when compared to the adults. And coming to the quantity of the toothpaste, just a pea-size amount is more than enough for the kids.
Okay. Yeah. So, so ma'am, this brings us to the other question, and it is said that prevention is better than cure. So, what would you like to suggest to all the parents out there to prevent their child from entering into the vicious cycle of dental caries? Like, how would you like to, what would you like to prescribe to all the parents, that what should they do to not let their children enter into the cycle of dental caries? Because one teeth gets a carious thing, and then the other, and then other, and then entire dentition is lost. So, yeah.
Good question, actually. So I would like to suggest parents that, here the awareness part comes into the picture. Because the more is the awareness, the lesser the problems. So if the parents are aware of the kind of problems that the child might have with the kind of habits the child is having, so if the parents are aware of that, then definitely they would take right precautions to prevent caries. So we can't stop kids from eating chocolates and junk food. So even I personally don't say that. But the only thing is, from the initial stages of their life, like their early stages of life itself, we need to teach them certain habits like twice brushing daily and rinsing, proper toothbrushing techniques. So all this, if if the parents are able to guide the children in a right way, probably that could be a better step to avoid dental caries.
Sir, so I have heard this from many kids saying that can mouthwash be a substitute for cleaning or brushing our teeth? So, is this even like a valid question for that matter? Sir?
Hello?
I
Yeah, I can't hear you.
Yes, sir. So, actually, many times the kids who come to
Hello?
us, hello, sir, am I audible?
Mm-hmm.
Hello?
Yeah,
Yes, sir.
yes. Now, okay. Yeah.
So, sir, many times the
Yeah,
kid
I
who
can
come,
hear you. Mm.
yes, sir.
Go
So,
ahead.
many times the kids who come to us, they have this big question saying that can mouthwashes be a substitute for toothbrushing? So, is it something which can be like
Yeah.
asked into like taken into
Yeah.
consideration?
No, mouthwash cannot be a substitute for oral hygiene maintenance. As you know very well, oral hygiene maintenance consists of brushing the teeth, flossing your teeth, and rinsing with the mouthwash. So it's a part of oral hygiene maintenance, and oral mouthwash cannot never can be a substitute for your oral hygiene maintenance. So you have to brush, floss, and rinse with the mouthwash for the better oral hygiene.
Yes, sir. So, ma'am, there is something I would like to ask that how the parental behavior could help a child to build good oral hygiene.
Yeah, Pallavi. So obviously, let it be any matter, not only dental health. Um, the way the parent reacts, the way the parent behaves, everything has an influence on child. So probably, I hope it to be a positive influence on the child. So if the parents are before preaching the children, first the parents should be having a habit of twice brushing daily. So these things, basic things. So if the parent is doing, then automatically the child will have a positive influence, and even he would start up with this. So I would request all parents who are on the session, you please start. It's never late. So if you are not in that habit, please do start that habit so that it will have a positive influence on your child also.
So it's better late than never. So kindly
Yeah.
brush twice daily. So, ma'am, here this is the question for the adolescent kids or the growing up kids that we tend to consume more amount of carbonated drinks. So, how does it affect the oral cavity?
Yes. So teenagers out there, um, actually, I would like
Hello.
to say, Pallavi, there's a problem, audio problem, I believe.
Hello, sir, am I audible?
Yeah, Dr. Chandra is having a audio problem, I believe.
Hello, sir.
No, he's not able to hear.
Yeah,
Okay.
actually, I can't hear you.
Oh. Hello, sir. Am I audible?
Is audio okay? Now there is a break. There is a break. I can't hear completely. Yeah. Can you repeat the question, please?
Sure, sir. So it is like all the adolescents or the people of our age tend to consume more amount of carbonated drinks. So how does it
Yeah.
affect the oral cavity?
Yeah. Usually we don't. As a part of oral hygiene maintenance, we advise patients not to drink carbonated drinks. As you know, like it tends to wear out the enamel. the surfaces of the teeth. When you make it a habit, when you take in a probably once in a while, it's okay. We can advise them, but taking carbonated drinks on regular basis will have a bad impact on the enamel or the surface of the tooth, and there will be abrasions and erosions will be seen on the enamel of the teeth and leading to the tooth decay and sensitivity of the teeth. So usually we don't advise the patients to take carbonated drinks on regular basis. Once in a while, yes, we can advise them to take.
Sir, so this question is probably from the oral surgery point of view, that there is a myth regarding the molar teeth, that they are the wisdom tooth, so they are not supposed to be extracted. But then there are children, there are people who do not have a sufficient amount of place in their oral cavity and tend to have the wisdom tooth coming in all the other directions than the one which they are supposed to come. So they tend to pain, they have the pericoronitis problem. So usually some of the kids or some of the like the people in the age group of 21, 22, they self-prescribe themselves medicines. So what would you like to tell them, like antibiotics and stuff? So
Yeah. This is also a myth which we come across from our patients on regular basis, like wisdom teeth removal. Wisdom tooth is something usually it will erupt at the age of 21 to 25 years. So that's how when the kid have the wisdom at that particular point of time, it is named as a wisdom tooth. So usually most of the tooth will erupt into the oral cavity. In 30 to 40% of cases, tooth will erupt in the oral cavity in good condition. They can be used for chewing and regular diet habits. But most in of the late, we see most of the cases where wisdom teeth go impacted inside the bone and going in a different directions. Okay, so we usually, unless until if the patients doesn't have pain, okay, they can maintain it with the regular oral hygiene maintenance. But when they have symptoms like pain in the jaw, like inflammation, having the pus discharge, or else any other, we advise patients to have the proper dentist analysis and the checkup and get the dentist consultation done. So we see from most of the patients, they try with the homemade remedies. Number one. Number two, they go to the medical shop and get the OTC product, like over the counter medicines. And after that, they will try to visit the dentist. So I want to mention here, like whenever you have any problem, not only related to wisdom teeth, any pain or any problem related to it, go to the dentist rather than going to the pharmacy and get the proper evaluation done. Don't take any antibiotics or painkillers which are given by the pharmacy people, because as you know, like you come across so many cases, people are having bad impact. Like we see most of the people dying out of this anaphylactic shock, like taking some antibiotics which are not advisable, and probably it is a habit for the pharmacy guys, but not for the people to take those antibiotics. Okay, so it's always advisable to go to the physician or dentist, get the proper evaluation done, and take the medicines. So it's always good to
yes,
visit
sir.
the dentist and get the evaluation done.
Yes, sir. Well said, that we are not supposed to take over the counter medicines at any cost, because visiting a doctor is a must. So, ma'am, here comes a question for you. This is like, what is the impact of good oral hygiene on a child's mental health?
Yes. Um, I think a child with good oral hygiene has obviously a good confidence level when it comes to the schooling level or preschooling level. So a child with carious teeth, probably the other children would be pointing out at them, saying that the teeth are not in a proper condition, the teeth are not looking correct or so. So that would affect the confidence levels of the child. Is it audible, Pallavi?
Not only
Just the connection lost. Now it's audible.
Okay.
yeah,
Yeah,
not only child. I want to add a point to that. Not only child. I want to add a point to that. Even we see a lot of patients, adult patients, where they are socially isolated and losing confidence just because of the dental issues. They actually want to avoid dentists because they have some myths and confusions, like saying that if you go to the dentist, you come across you have so much of pain, you cannot take up that pain. So keeping those things in mind, people avoid going to the dentist. So even children and adults, like with dental issues, definitely will have that mental disturbances in mind.
Yes. So, sir, this confidence thing brings me to one more question. That is,
Mhm.
like people, even with crooked teeth, like in layman's term, or maybe I can say with malaligned teeth, avoid going to an orthodontist to fix the malalignment, because they think that the procedure takes a longer while. Maybe it can go up till 2 years, 2.5 years, and the bone remodeling pains. So, what would you like to suggest them?
See, having crooked teeth is not something bad, but only thing is when you have a crooked teeth, you will have difficulty in brushing your teeth. See, you can't maintain the oral hygiene properly because of the crooked teeth. The food gets lodged in between the teeth, and which cannot be cleaned with your regular toothbrushing or mouth rinsing. And apart from this, this crooked teeth or having the dental abnormality will have a bad impact on your jaws. So when we bite your teeth, all the teeth has to be come under one, bitten under one surface. When you have a crooked teeth, you tend to have that abnormality in the chewing, so you tend to land up in your temporomandibular joint disorders, and you have a oral hygiene issues, you have a gum problems, you have a when you don't brush your teeth properly, you'll end up in having the dental cavities. So there are a lot of issues people will face when they have a crooked teeth. So we advise patients to get the dentist consultation again to have a proper evaluation of the teeth and get the orthodontic treatment done.
Yes,
yeah,
sir.
no pains, no gains, right, Pallavi?
True, that is.
Oh, unless until the patient takes up the pain to come down to a dentist, get the treatment done, the patient cannot have a beautiful smile, right?
Yes. So, ma'am, this is the era of growing aesthetics.
Yeah.
Everybody wants to have a beautiful smile. So, what would you like to suggest, maybe to boost up the confidence of everyone regarding the aesthetics and the smile needs which everyone have?
Yeah, smile, it plays a major criteria, irrespective of your field, irrespective of your age, irrespective of anything, smile. Any person would like to have a good smile. And I believe a smile makes a day. Let it be anyone's day, probably your day
True.
or someone else's day.
Yeah.
So, smile should be making someone's day. So, come to your dentist, do approach your dentist, get your smile fixed, and be happy.
Yes.
And it is a fact. You, if you have a beautiful smile, you have a more confidence in you. So I see that from a lot of patients. I see a lot of geriatric cases. They don't socialize themselves because of this not having the proper teeth, proper they maintain them very low. When we rehabilitate them with proper teeth, so they come and say that, like, sir, we have really built up ourselves. We have a lot of confidence now. We are going out, mingling with the people. So having the beautiful smile, beautiful teeth definitely builds up your confidence.
Yeah. So, ma'am, these were the questions which I was supposed to ask. And thank you so much, sir and ma'am, for answering all our queries. And now I would like to hand this session again back to the original hosts that we had. Chaitra, on to you.
Yeah, thank you. Thank you so much, Chandrasekhar sir and Rekha ma'am. Thank you, Pallavi, for being such a great host for this panel discussion. It was quite illuminating and insightful session. I think our audience have gained an ample of knowledge on oral care and health. Now, I would like to request everyone to ask if any questions regarding the topic. The
Yes,
session is
thank you,
open to
Chaitra.
audience.
So any questions from the audience?
Actually, we have questions in the chat box, ma'am. I will read them for you. We have a question from Siddesh. He's asking that nowadays we have electric brush and they provide wide variety of functions such as cleaning and deep cleaning, and there is no awareness for the same as well. So he would like to ask, what kind of brush is good to use for daily basis? Is it manual or electrical? And what would be your suggestion with respect to its use and age criteria also for it?
Yes, Chaitra. So coming to this question, I would like to answer in this way. Electric brushes or powered toothbrushes are also available. So they are a good source of cleaning actually, of maintaining your oral hygiene. But usually, normal people can go for it. But it is usually recommended, apart from the normal people, in cases of bedridden cases, like where the patient is not able to have the manual brushing. So in such cases also we do recommend the power toothbrushes. So the power toothbrush mainly works on the principle of vibration, and it has a better efficiency of cleaning the oral cavity when compared to the manual toothbrushing.
Okay.
And on the top of that, it has usually we advise children or kids to use power toothbrush on for probably during night time. Usually, this power toothbrush have the automatic mode of 2 minutes. Like automatically, it will cuts off at the end of 2 minutes. So kid will understand like he has to complete the completely brush for 2 minutes so that the brush will gets off by itself.
Okay, sir. Yes, ma'am. And we have another question from Eva Singh. She would like to ask that correct brushing method, like and rinsing, can keep teeth clean, healthy. Then what about gums and how to keep it healthy, or brushing is only sufficient for both teeth and gums?
No, here I would like to add something. See, oral hygiene does not necessarily mean only tooth cleaning. It means a gum cleaning along with the tooth cleaning. So usually brushing would serve the purpose of tooth cleaning. So coming to the purpose of gum cleaning, your mouthwashes they play an effective role in the in this aspect of gum cleaning. So I do advise people out there to have twice brushing along with rinsing with a mouthwash.
And on the top of that, we advise also patients to do gum massaging. Gently, you can massage daily for 10 minutes, probably 5 minutes in the morning, 5 minutes in the night, so that you'll have the better circulation and chances of getting the gum disease will be very less.
Yes, sir. Thank you so much. And we have another question from Pratibha Reddy. She's asking can I know why there is a pain when wisdom teeth is breaking out? Like she want to know the reason
Yeah.
behind the pain, and some also get fever
See
when they
you.
are getting wisdom. Yes.
See, usually a properly erupted wisdom tooth will have that mild pain of breaking through the gum and getting into the oral cavity. So usually when the wisdom tooth is erupting into the oral cavity, being the last tooth to erupt in the oral cavity, usually the food will get accumulated there, and and when we brush our teeth, the head of the toothbrush doesn't reach the posterior most part of the oral cavity. So that is the reason usually when the wisdom teeth are erupting, we have to make sure that our toothbrush is reached that particular area and cleaned properly. And also when the wisdom tooth is erupting, we always advise patients to use the mouth rinses so that it will reach that particular area, and overall that the area of the teeth is kept healthy. So there is a difference when the properly erupting wisdom tooth when the wisdom tooth is erupting properly, you will have the pain and tenderness for probably for a week or 10 days. If it is not erupting in a right direction, you'll end up in erupting in different direction. You'll have the jaw pain, jaw sensitivity, muscle tenderness. So it is always advisable when there is a when the wisdom tooth is erupted, you better go to the dentist and have a proper evaluation.
Okay. And we have another question from Rushda. How can dental sensitivity be treated? So most of the people, and also from Ruthvik, the same question I think. So most of the people have a problem of tooth sensitivity when they consume cold items. So are there any preventive methods for it?
So dental sensitivity, the word itself is a very vague term. Usually, the dental sensitivity we see a lot of patients who cannot differentiate between dental pain and dental sensitivity. So usually, this dental sensitivity has so many reasons. One and number one is like when you brush your teeth hard, your surface of enamel tend to wear. So when your enamel surface is worn off, the inner surface of the tooth is called dentin, where your nerve endings are there. So because of that, when you take extreme hot and extreme cold, you'll have that sensitivity. So and there are the conditions when you have a tooth decay, you'll tend to have the sensitivity. So sensitivity itself is a very vague term, and when you have a teeth sensitivity, and it is always better to go to the dentist and get the properly evaluated, like what is the reasons for sensitivity. And we come across so many people when they have sensitivity, they see this TV ad of Sensodyne. When they have a little bit pain or sensitivity, they go to the pharmacy and buy the Sensodyne toothpaste, and they complete two to three tubes, and after that their sensitivity doesn't come down, and they come to the dentist again. So there is no reason, like so don't get into this get into this habit of going to the pharmacy and buying the toothpaste, like medicines, antibiotics for no reason. Always we suggest go to the dentist, get properly evaluated. Probably problem may be the big or small. Get the dentist suggestion and work accordingly.
Yes, sir. Uh, yes, sir. We have completed all the questions. I want to ask both of you, sir and ma'am, to give a home message for all the audience over here. Take home message. Any take home message from Bharat.
So take home message is see the main purpose of this oral health day is to basically to create confidence in the people to secure good oral health. So we as a dentist, we want every one of you to spread awareness of oral health so that the people near and nearby you go to the dentist and get the proper evaluation done.
Yeah.
That is the main purpose of this oral health day. See, creating awareness is very important. See, dental problems are always can be prevented and can treated. Unlike any other problems, you take any diabetes or you take cancer or anything, nothing is there in our hands. It is genetic, and cancer is something which we don't know the reason why we get the cancer unless until you have a proper strong cause. Most of the diseases are not in our hands, but dental diseases are very much in our hands. It can be prevented and it can be treated. So having some good awareness is very much important, and so that thereby you can reduce this trauma of pain and losing the confidence. Always, and apart from that, we always suggest, whether you have problem or not, you go to the dentist regularly, visit dentist every 6 months, so that anything has to be done, dentist will advise you.
Yeah. My message to the audience would be let it be not only dental, let it be any systemic problem. The smaller the problem, the smaller would be the treatment. So consult your dentist when the problem is small. So, and I think the purpose of this meeting also, it's a oral health awareness program, right? So many people, even at this point of time, probably some years back, oral health was um, not recognized as having so much of importance. Even at this point of time also, I see many patients saying that, is it important to get this treatment done? So message from my side would be like, just as Pallavi said, mouth is the mirror of your body, right? So whatever it is, you need to have a dental checkup every 6 months or a year. So when problem is small, then definitely the treatment also would be small. So better go to your dentist at regular intervals, get your teeth checked, and have a healthy and happy teeth.
Yes, ma'am.
Yeah,
Thank you so much.
welcome, Chaitra.
Yes,
And
ma'am.
I think we could clear few doubts from our side.
Yes, ma'am. Actually, there are another questions from chat box, ma'am. Shall I read it out?
Yeah, you can go.
Yes. Okay, ma'am. Siddesh is asking again a question like many Ayurvedic toothpaste have clove as the main ingredient, so it's very well known to have gentle anesthetic effects. So should we worry about it as we are using it on daily basis? What about loss of nerve sensitivity?
No, no, no. It is not. It is not proven that it is going. Usage of clove on a daily basis would be giving you loss of nerve sensitivity. So, according to Ayurvedic science, yes, it has been proved that clove has a good anesthetic effect. So, it's been incorporated in very little amounts in the toothpaste. So, you can go for it, but it does not have the kind of effects or myths you are thinking about.
Basically, you cannot use this cloud toothpaste as an alternative to the dental pain. So, usually, what happens when you use this cloud toothpaste,
Hello? Hello, sir. We are not hearing. We are unable to hear you.
Yeah, I think there's an audio problem, Chaitra.
Yeah. Yes, ma'am.
Yeah, I got him actually. What he wants to say, like many people use it as an alternative to dental treatment. So that since it has an anesthetizing effect, they think that it would anesthetize the tooth for a while. So that should be an alternative to the treatment. No, it's not an alternative to the treatment. Uh, Besides a regular toothpaste, you can definitely use it. There is no harm in using it, but it is not an alternative to the dental treatment. That is what he wanted to say, I believe.
Okay, ma'am. We have another question like we will see charing of teeth when we consume some drugs. So how we can prevent it, and if it is already developed, then how it can be treated?
Yes, few drugs do have side effects, but avoiding that is not possible. So probably some treatment would be required. Like few drugs would be having a side effect as erosion of the teeth. So probably that can be corrected with some dental treatments.
Okay. Okay. Now we have finished all our questions and we have cleared doubts of all the audience over there. So I would like to announce the winners of PRT competition. So I want to congratulate all the ones who have kept their efforts to participate and present their arts. From the category 1, kindergarten to 5th standard, the first prize goes to K. Manushree, Class 2B, Sri Chaitanya E School, Secunderabad. And second prize goes to Bhuvi Mundada, Sri Krishna Colony, Warangal, Telangana. And third prize goes to Tahini St. Anne's School, Secunderabad. And coming to category 2, 5th to 10th standard, the first prize goes to Noora Amina, Class 8B, Grammar Oxford School, Hyderabad. And the second prize goes to Muhammad Ghaus Mohiuddin, Class 10E, Slade, the School, Hyderabad. And the third prize goes to Ahil Muhammad Abdul Rahim, Class 10E, Little Flower School, Hyderabad. And while coming to category 3, which is open for all the age groups, so there is only one winner here, who is Zainab Firdausi, Glendale Academy. She's a teacher from Hyderabad. I want to congratulate everyone who have who have won the clear competition. I want to also congratulate everyone who have kept their efforts to participate and present their arts. Thank you so much, Dr. Chandrasekhar, sir, and Dr. Rekha, ma'am, for joining us today. And also, I want to thank Pallavi for making an excellent discussion with our panelists. It was an amazing experience to hear your incredibly interesting and informative session. Hope you all have enjoyed it and gained ample of knowledge from it. I want to invite Ritvik to speak some few words. Over to you, Ritvik.
Good evening, everyone. I'm Ritvik, a family third year pursuing student and a clinical research intern at CliMed Research Solutions. First of all, I thank Dr. Reika Allari ma'am and Dr. Chandrasekhar Alladi sir for joining for this interactive session and giving a lot of knowledge regarding and clearing all the doubts and the myths regarding the oral health and hygiene. And I really thank Dr. Pallavi ma'am for asking the questions and clarifying all the doubts. Thank you so much.
Yeah. Thank you, Chaitra. Thank you, Dr. Ajit Singh, Pallavi, and the whole team of CliMed Research, that you have given us an opportunity to clear a few doubts. And I hope we have been successful in giving some knowledge about the oral health awareness program. And it's been a wonderful session. It's been wonderful interacting with all of you. Thank you
so much. Thank you so much, ma'am.
Congratulations to all the winners and the participants.
Yes, ma'am. Thank you so much. I want to congratulate once again the winners with great enthusiasm. We hope you all again participate in further competitions. I want to end up with a small quote. Don't rush when you brush. Life is short. Smile while still you have teeth. Thank you, everyone. Have a great day.
Thank you.